skin look like this? Or have you seen skin that looks like this? By the time we finish this video, you'll be able to recognize the condition, Folliculitis Decalvans, sometimes called dissecting cellulitis. It's a form of scarring alopecia. You're also going to learn some of the main things that we dermatologists use to treat this condition. Let's look at the top of the scalp. As you're looking at the top of the scalp, you see a lot of inflamed hair follicles. There's a good amount of redness and dryness that surrounds these hair follicles. There's some obvious scarring in between the hair follicles, and if you look closely, you'll see some yellow-colored crust that kind of adheres to the surface. These are some of the main things that you can consider when treating this kind of inflammation. Doxycycline, antibiotic you can take twice a day, loratadine, antihistamine twice daily. Some of the topicals will include furosemide solution, massage into the scalp twice daily, ketoconazole shampoo where you will lather and rinse after 5 minutes of contact once a week. Also prednisone 5 milligrams once a week. Unless the patient has a history of diabetes or risk for increased blood sugar, in which case you want to hold the prednisone 5 milligrams or limit it to a one-time dose only. Let's also look at the back of the scalp. When looking at the back of the scalp, you can see even more apparent scarring. There is some larger keloids. Some of them are larger, elongated, and stick out from the surface. There's also a smaller, pebbly variety lower on the scalp near the base. Some of the in-office treatments that will be considered to treat these kinds of structures on the back of the scalp include, for the larger, elongated variety, they can be resected with simple surgery. You can also follow that with therapeutic injections, irradiation, and also freezing them with liquid nitrogen spray just to cut down on some of the size for size reduction. The smaller pebbly variety, they really should be treated with therapeutic injections. Sometimes you can also use some cold liquid nitrogen spray for the smaller variety also. Scarring conditions are very common in Black Americans or persons with darker skin type because of the increased collagen production. The increased collagen production can be a blessing and a curse. It's a blessing in the sense that, races and ethnic groups that have more melanin production, that produce more collagen, they have more anti-aging effect to the skin from that increased collagen production. It's a curse in the sense that Black skin has a higher risk for scarring and scarring conditions because of the higher collagen production also. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge in Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.